Hello everyone, this is Dr. Lashik, and this lecture we're going to go over Chapter 11, specifically threats to internal validity. So this delves into more detail on experimentation and things that could cause problems for those experiments, like confounds. Alright, like I said on the last slide, this chapter is primarily about internal validity and how to strengthen experiments. There are three main threats to internal validity that we discussed in Chapter 10, and those are design confounds, selection effects, and order effects. So let's recap a little bit before we begin talking about more of those threats. So remember, first of all, internal validity means, are there any other alternative explanations for the results? Another way to ask the same question is in the red type on the slide. Did the independent variable, or the one that we manipulated, really cause the difference that we measured in our dependent variable? So let's recap the three that we already discussed in Chapter 10. First of all, design confounds are any systematic differences in the design of the study that could be the cause of the results. And so what that means, again, is differences we didn't intend between conditions. So if everything goes according to plan in our experimentation, the only difference between condition 1 and condition 2 should be the change in our independent variable. Everything else should be kept constant. That way, when we get our results, the conclusions that we based on those results can be purely attributed to the independent variable. There's no other alternative explanations. So a design confound is anything that accidentally became systematically different between conditions. For instance, let's say we're running an experiment and we decide to measure condition 1 on day 1. And during condition 1, all of the participants hear this really loud, noisy construction outside of the window. And then on day 2, we decide to measure condition 2. And on day 2, there happens to be no loud construction noises outside. When we get our results at that point, if there are any differences in the dependent variable, it could not only be due to our independent variable, but also possibly due to the construction noises outside. And so it was a design confound in that we had attempted to control for it, but still it ended up being systematically different between our conditions, and therefore a possible explanation for the results. A selection effect has to deal with non-random assignment, and if you recall, random assignment is making sure that there is a random chance for every participant that's participating in the study to end up in condition 1 or condition 2. That way there are no systematic differences between the types of people who are involved with condition 1 versus condition 2. So for instance, let's say we were running an experiment, and just to make it easier on ourselves, we decide that every female participant who comes to participate will be put in condition 1, and every male participant who participates will be put in condition 2. This is a selection effect, and therefore a problem, because if there are any changes in our dependent variable, and we get results that support that there's a difference, it could be due to the independent variable or the gender of the participants, and therefore we do not know which to attribute that change to. The last one, order effects, has to do with repeated measures designs only. And if you recall, repeated measures designs are where every participant in the study experiences all the levels or conditions of the independent variable. And this is a problem if the order of the conditions that are presented to the participants actually influences the results at the end. So maybe being exposed to condition 1 before condition 2 alters the results in some way. Whereas being exposed to condition 2 first and then 1 doesn't alter the results in a significant way. So to make sure that this is not a problem, you can fix it with counterbalancing. And that means half of the participants would experience condition 1 first and then condition 2 second, where the other half of the participants would experience condition 2 first, and then condition 1 second. So any changes due to order effects will be washed out. So this chapter goes over all of these threats to internal validity, including the 3 we just discussed. There are 12 total threats to experimental internal validity, and we're going to go over those for the rest of this lecture. In the last chapter, we went over 4 different designs for experiments. 2 broad categories: independent groups designs, also known as between subjects designs, and then repeated measures designs, also known as within subjects designs. The independent groups designs, or the between groups designs, there were 2 types. There was the post-test only between groups design and the pre-test post-test between groups design. In the post-test only between groups design, participants only experienced one condition of the independent variable, and they were only measured after the manipulation had occurred. In the pre-test post-test design, they were measured prior to their exposure to the independent variable, and then they were measured after to see if there's any change between their previous scores and their post scores. But there was always another condition. So another group of participants received maybe the second condition of the independent variable. First they were measured with a pre-test, exposed to condition 2, and then measured with a post-test. In within groups designs, or repeated measures designs, participants experienced all levels of the independent variable. And so with the concurrent version of the repeated measures designs, both or all of the levels of the independent variable were presented to the participant at the exact same time, and then they were measured on some variable. Usually those are for preference studies. So here are all levels of the independent variable. Which one do you prefer? The repeated measures design, or the simple repeated measures design, is participants are exposed to all levels of the independent variable, but at different times. So half of the participants might be exposed to level 1 and then measured, and then exposed to level 2 and then measured, while the other half would be exposed to level 2 first, measured, and then level 1 measured. So our really bad example, or a really bad experiment, is a whole different design all in of its own. And the reason it wasn't discussed in the last chapter is because it's really bad. It is full of internal validity errors. And we're going to talk about why. It is called the one-group pre-test post-test design. It's a combination of both the repeated measures design and one of the pre-test post-test between subjects design, and it doesn't work. If you think back to chapter 1 or 2 when we talked about comparison groups and why they're so important, you might remember an example in the textbook where we talk about bloodletting, and it goes through a scenario where it talks about back then they thought bloodletting worked. And the reason was is someone would come into the doctor really, really sick, and then they would receive bloodletting, and then they would show a decrease in their sickness. And so they just assumed it worked. What they didn't do was they didn't have a second group of people who came into the doctor really, really sick, just let the disease take its own course, and then measure them again. That would have provided a true comparison group. Simply comparing it to your pretest score without having another group of people who experienced a different condition does not offer enough information for us to actually make a valid comparison. And so that's exactly what this is talking about. And so it demonstrates why a pretest score is not a valid, simply by itself is not a valid comparison. And you actually need a second condition where you have a pretest post-test in order for it to work. And so here's a couple of examples of a one-group pretest post-test design, and then we're going to talk about why they're so full of errors in the following slide. So the first example is shown here with graph A, and it's about imagining that we are camp counselors, and we have all these campers, and we notice that our campers are very obnoxious. And so we think that their rambunctious behavior is due to these sugary snacks that we're letting them eat. And so we decide to test our theory. We eliminate the snacks from their diet, and then within 2 days we notice that the campers are much less rambunctious. So you can see here at the beginning of the week, high rambunctious scores, end of the week, lower rambunctious scores. Another good example is in graph B there. We have a group of depressed people who go to seek psychotherapy. And while they're there, they opt to participate in an experimental therapy, which is a drug therapy. So all of the participants, the entire group of depressed people, receive the drug and then later report feeling much better. So that is depicted by graph B, because as you can see, pre-therapy, high depression scores, post-therapy, low depression scores. So issues with the design. Well, most importantly, there's only one group. Everybody is receiving the treatment in both A and B. There is no one who did not receive the treatment. There is no comparison group. Again, we cannot just compare to pretest scores. We have to be able to compare to a different condition of some sort. So how are these different than the repeated measures design? Well, the repeated measures design, again, has two different conditions. Maybe two treatments, or maybe a control group and a treatment group. But either way, there are still two conditions. In a repeated measures design, they do something to you, condition 1, measure, then they do something different, condition 2, and measure again. With a separate group of people, they do condition 2 first, measure, and then condition 1 first, measure. And if condition 1 is a control group, that's fine, but as you noticed from my explanation of the repeated measures design, one has to come first and then another. We can't just assume that everything was the same for people prior to the pretest like we are with this one group pretest post-test design. We actually have to control that to make sure that their surroundings and their conditions are exactly the same, besides our manipulation of the independent variable. And we're not doing that with this. We're just giving them a pretest before they even receive anything, and that's not adequate. It could be, for example, especially with our depression example here, maybe it's possible that if the therapist gave half of those people no drug therapy, it's possible that depression just kind of goes away after a short period of time, and at least decreases somewhat, right? And so we don't know if it was just due to time, the elapse, or how time has just elapsed, and that's what caused the decrease in depression, or if it was truly the drug. And those are the kinds of internal validity problems that this version of an experiment causes. All right, like I said in the previous slide, there are 12 threats to internal validity when considering experiments. We've already been through the first 3, design confounds, selection effects, and order effects. The bolded internal validity threats here are primarily an issue for the one group pre-test post-test design, meaning the really bad experimental design that no one uses. And the reason they don't use it is because these bolded 6 internal validity threats are a serious problem for that design, and we'll explain why in a second. The non-bolded ones are potential problems for all types of experimental designs, even the 4 good ones. And so we can't get away from all internal validity threats. We have to try really hard, but we can certainly get away from the bolded 6 if we avoid the one group pre-test post-test design. And I'll explain why in a second. So again, we've already been through the first 3, so let's start by talking about maturation. Again, the bolded ones are only for the really bad experimental design, the one that is not used. All right, a maturation threat is a change due to the passage of time, not due to the independent variable. So for example, with our camp counseling example, let's say we know that our campers were obnoxious at first, but then because they settled into their cabins and they began to calm down naturally, they might actually reduce their obnoxious behaviors naturally, and it may not have had anything to do with the exclusion of the sugary snacks. So this would be a maturation effect. The other example of depression, again, I used this example in the previous slide. Depression may have just improved with time. This often happens with psychological problems like depression, right? And so it may not have had anything to do with the independent variable. So to avoid maturation threats, we include a comparison group. This will rule out maturation effects. For instance, with our camping scenario, one group would get the sugary snacks taken away, while a second group would keep their sugary snacks. And then we would see if there was a change that was more significant than simple maturation. So if it was only maturation that was causing the difference between sugary snacks and no sugary snacks, then we would see an equal amount of change between group A and group B, slight decrease in obnoxiousness. But if we saw a much more significant decrease with the exclusion of sugary snacks than without the exclusion of sugary snacks, we could conclude that sugary snacks had something to do with it. Very similarly, for the depression example, one group would receive the drug treatment while a second group would receive a placebo. If the one who received a drug treatment exhibited a much more significant decrease in depression than the group who did not receive the drug treatment, we could conclude that the drug had something to do with it. The second one is a history threat. A history threat is any external force that occurred between the pre and the post test that was uncontrolled for, which actually caused the results. For example, let's go back to our camper example. Perhaps the campers started out obnoxious, but then because they all took up a swimming class halfway through that week, they became tired and more calm. So their reduction in obnoxiousness had nothing to do with the sugary snacks. It had to do with something that happened to everybody in between the pre and the post test that was not controlled for. So any external event that affects most of the people in the study at the same time as the treatment is considered a history effect. How do we avoid history effects? We include a comparison group. If our campers had one group where they did not get sugary snacks that week and another where they did get sugary snacks that week, if both groups showed comparable change, it is likely due to the swimming class or some history effect. However, if the no snacks group shows significantly more change than the snack group, it is likely due to the snacks themselves, or at least partially due to the snacks themselves. Again, the importance of a comparison group is integral when doing experimental research. All right, a regression threat is a shortened way of talking about regression to the mean. So a regression to the mean is when someone does exceptional at a task in one instance. It is more likely that they will have an average performance the second time around just because we tend to regress to the mean. Let's talk about a couple of examples of this. I have a very limited understanding of soccer, but it's great for an example. So let's say one team in soccer scores loads of points during a game, way more than average. It would be a safe bet to assume that they will score fewer points the next game, or at least an average number of points. Let's say that the average number of goals per game is 3 goals. Of course, I'm not sure if that's true, but let's just say it's 3 goals. If a team scores 7 goals during a game, it is a good estimate that they would score fewer than 7 in game 2. It is unlikely that all of the chance random circumstances would align in such a way to allow another 7-point game or another exceptional performance. Another example of this regression to the mean is, let's say you're typically a happy person. However, sometimes due to random factors, things during the day can turn your mood sour. Maybe you experience poor parking, or a bad grade on a test, or one of your friends treats you poorly during the day. It is unlikely that all those same random factors will happen again tomorrow, so we are almost certainly safe in assuming that tomorrow will be better. we intuitively understand that these extreme atypical behaviors or scores in soccer or instances don't last forever, and that they eventually regress to the mean or get closer to an average score through repeated iterations. This is a threat to internal validity. For example, thinking back to our depression example, these people who sought out this treatment, when they did that, when people seek out treatment from a psychotherapist, it is usually because they are more depressed than they have ever been, or they are experiencing an extreme version of whatever mental thing that they're trying to deal with. They might be suffering from some extreme version of their symptoms. Therefore, during the post-test, it is likely that naturally their scores might at least be slightly better. In other words, they've regressed toward the average depression score at least a little bit. So to avoid these regression threats, like we will say for almost all of these threats, we should include a comparison group. If both the experimental group and the control group are equally extremely depressed on the outset, we can compare the differences in change at the end. So all will regress to the mean naturally, but if the treatment worked, that group will change even further. So even with the comparison group, we can still have a regression effect in one instance. So if one group starts out more extreme than the other. However, this is why we use random sampling and random assignment, making this possibility very unlikely to occur. The fourth one is attrition effects, an attrition threat. When participants drop out of the study before it is done, it is considered attrition. It is a threat to internal validity when those who leave the study represent systematic characteristics of the participants. So let's talk about it with an example. In our camp counseling study, let's say the most obnoxious kids get in trouble, and they are told that they have to leave camp early if they don't shape up, and they end up being kicked out of camp. In that case, the reduction of obnoxious behavior has nothing to do with the sugary snacks. It has to do with the loss of the participants who were most extreme. Without them, there's actually no effect. With the example of depression, maybe the most extremely depressed people cannot withstand the treatment. It's just too difficult on them, so they drop out, leaving only the mildly depressed people as participants. Attrition is typically not a problem in research, but if the attrition is systematic, it is. So if attrition is random or unsystematic, where it's just as likely that just as many people would leave the study with one characteristic as another, then again, it's not a problem. It's only a problem when only one select group of participants leaves the study early. So ways to avoid this attrition threat is to take out the scores of those who have dropped out of the study from the pretest average. So these pretests are often an average of everyone's score. Then the post-test is usually an average of everyone's score. So if they dropped out before the post-test, removing their scores from the pretest data and recalculating the average should correct for the influence of those extreme attrition. The next one is testing threats. This is basically the same as order effects when discussing repeated measures designs. But remember, order effects are only concerned with the condition order. So if you experience condition 1 first, condition 2, that has a difference than if you experienced condition 2 first to condition 1. That's an order effect. Testing effects are very similar, and that they might also be a problem. And it's when we use the same dependent variable for the same person, time 1 and then time 2. So like a pretest post-test design might have a testing effect, or maybe still a repeated measures design if how you measure their behavior, both time 1 and time 2, uses the same measurement. And testing effects are specifically about practice effects or fatigue effects. And practice effects are the first time you take it, you fumble around with it a lot, but the second time, because you've had practice taking it the first time, you do much better. And again, that's a problem because it has nothing to do with the change in the independent variable. It has to do with practice on taking the survey, and that's not good. Similarly, fatigue effects have the opposite outcome. So that's where you take it time 1, it wears you out and makes you so fatigued that when you take it time 2, you're just so burnt out you can't give it the focus it requires. Again, that's a problem because we don't want our participants doing more poorly on it time 2 only because they're so very tired. All right, again, this has nothing to do with the condition order. That would be an order effect. It has everything to do with having taken the DV so many times that it's impacting our ability to take it. Let's go back to the example we talked about in chapter 10, and that was the Seeing Red study. In the Seeing Red study, remember, they saw a booklet that had either the color red or green on it, and if they saw the color red, they were able to complete fewer anagrams in a test booklet than if they saw the color green. So let's pretend that was a pretest post-test design for a second. If that was true, then the participants would have received an anagram booklet with no colors on the cover. They would have completed as many as they possibly could. Then they would have received a booklet with either the red or the green coloring, and then completed more anagrams. If that was true, there's a chance that maybe the first time through, having never completed anagrams before, a participant is fumbling around and doing really poorly. But once they get the hang of it, before they were measured on it again, they start to do much better. It becomes easier for them. So that's a practice effect. And they would increase or improve in their ability to do those anagrams regardless of the booklet color. And that's a problem. We don't want to see any change for any other reason beside the color of the booklet. So to avoid this, how do we do that? We would use 2 different measures for the pretest and the post-test. Maybe one set of anagrams for the pretest, one set of anagrams for the post-test. Both would measure the same thing, but in slightly different ways because they're different problems. Also, including a comparison group might help. If the treatment group gets a higher degree of improvement than the control, then it's likely due to the treatment. And then, of course, counterbalancing. So maybe the first participant gets anagram booklet A, and then in time 2 they get anagram booklet B. Second participant gets B first, and then A. So you can see if practice effects were really a problem, and if a booklet A was at least semi-equivalent to booklet B in difficulty. The last internal validity threat that's specifically a problem for the bad experiment or the one group pretest post-test design is instrumentation effects. Instrumentation threats are when the instrument used to measure the dependent variable changes over the course of the study. This is primarily an issue in studies where the experiments measure a behavior by watching, so they include raters. The instrument in this case is the researchers or the raters who are doing the observations. For example, with our campers study, we are using, it's an observational research design, right? We are watching to see how obnoxious the kids start, how they end up. So maybe there isn't a change in the behaviors of the campers at all. Maybe the raters have changed their tolerance of obnoxious behavior over the course of the study, resulting in a difference. Another good instance of this is if the pretest measure is different than the post-test measure, but it was intended to be the same. So maybe it was for our anagram booklets, we have 2 separate anagram booklets, one with one set, one with another set. We think that they're the same in difficulty, but what we find out later as we go is that they're actually different difficulty. So now we don't know if it's due to the difficulty or if it's due to the color that they observed. So to avoid this problem, use a post-test only design. Remember, with between subjects groups, we don't necessarily have to do a pretest. It's helpful for making a comparison group if we're doing a between subjects design, but if we're not, but if we're doing a between subjects design and we can get away with only doing a post-test only design, that would help with this possible issue. Make sure our pre-test and post-test are actually equivalent would be another way. So testing it thoroughly in advance to make sure that they truly are equivalent in difficulty. Or if it's an observational design and the issue lies within our raters, making sure that our raters are actually measuring the behaviors the same throughout the duration of the study. And then finally, a good way to control for this is through counterbalancing again, so making sure that if participants are experiencing all conditions, that they get condition 1 first and then 2, and another group gets condition 2 first and then 1. So the main difference between instrumentation threats and testing threats, make sure you don't get these two confused, is that testing threats deal with a change in the participant, right? They practiced taking the measurement multiple times, so they have improved in their ability to do so. Instrumentation effects, on the other hand, are changes within the measure itself. So raters look watching for the behavior, they get tired of watching so stringently, and suddenly they receive different results because of that. So the last three here are internal validity threats that could even be a potential problem for the good experimental designs. So not just the one group pre-test, post-test, but for the good ones. And so we'll go over those. So those, again, since they're not bolded, they're like the first three, and that they're potential problems for all types of designs. Observer bias is only a problem with observational research, and when we have human raters looking for a behavior. This is when the observer's expectations affect the interpretation of the ratings. For example, let's say we're doing a research project that tests the theory that people tend to scratch their heads more often when they're solving difficult math problems than when they're solving easy math problems. So we're watching people solve math problems, and we end up counting more scratches on their heads when we're on the difficult condition, because our expectation is that they might be scratching their head more often. So remember when we talked about this in a previous chapter, there was an example experiment that was gone over. They talked about a video that was given to participants, and they said, okay, rate the personality characteristics of this man. Half of them were told that it was a psychiatric patient, the other half were told that it was a job applicant. And their expectations of what that means, either psychiatric patient or job applicant, colored their interpretation of his behaviors. And it did so very systematically. So to get away from it, we'll talk about how to get away from observer bias in a second. Demand characteristics are when participants change their behavior willfully because they think they've figured out the experiment that they're a part of. And this is typically an issue for the repeated measures design, because that's when the participant is exposed to all levels of the independent variable, so they see how everything has stayed the same besides this one aspect. And so they might think that they figured out what that one aspect is and what the researcher expects of their behavior because of this change. So a good way to correct for both observer bias and demand characteristics is to do a double-blind study. And that's where neither the participants or the researcher know which participant is in which condition. For example, with our campers, maybe we could make it seem like all of the snacks are the same so that the children don't have any idea who's in what's condition. So they received a nondescript looking bag of snacks that looks exactly like their friends, but what they don't know is that one bag of snacks has no sugar and one bag of snacks has high sugar. Similarly, it becomes double blind if even the experimenters don't know which bag is handed to which child. And so what they would do is they would They would mark, somebody would know and have a code sheet, but the people who actually do the handing out of the snacks have no clue which snack they're handing out to which child. Sometimes double-blind procedures are next to impossible. There are good alternatives, though. A masked design is a good alternative, and that is where the experimenter does not know the condition the participant is in, but the participant knows. However, this information does not give away the purpose of the study. And this is usually true in between subjects' designs. In our Seeing Red study, so the anagrams and the color of the booklet, the experimenters did not know what color booklet the participant would see because it was given to the participant in a manila envelope. But the participants would open up the manila envelope and see the color immediately. However, since they didn't know that that would be different between conditions, they could not guess that the color of the booklet would be integral to the study. The last internal validity threat is a placebo effect. And this is when someone strongly believes that they are receiving the treatment, whether or not they truly are, and that they should be improving because of that treatment, that they actually improve. This is very similar to demand characteristics. However, their symptoms actually improve in placebo effects, but not necessarily in demand characteristics. Demand characteristics are when the participant willfully changes their behavior, going against what they would have naturally done because they think they've figured out the study, whereas placebo effects demonstrate true change because the person thinks they've figured out the study. This is mostly relevant for medical studies when someone receives a drug treatment. Most of the participants will feel better because they're taking a drug, whether or not it's a placebo. Because if they have an expectation to improve after taking the drug, they will improve. There's research evidence out there that we can actually get rashes due to taking placebos only because we believe we are taking the real drug. So beliefs have real consequences, and this is a problem in psychology, especially if the participant is in the know about what condition they are in. So how do we avoid this? First of all, we would do a double-blind placebo control study. So this is where neither the participant nor the researcher know the participant's condition, and the comparison group is a placebo or a control group. In this case, it is likely that both groups would improve because of the placebo effect, but if the treatment group improves more, it can be determined that it was due to the drugs. All right, if you have any questions about all of these internal validity threats, please don't hesitate to email me.